Welcome to Forging Radical Hope, a special podcast mini-series from the American Journal of Public Health 2024 Student Think Tank. We're kicking things off with a two-part episode. Part 1 features Kathleen Patti, an MPH student at University of North Florida, and Part 2 features Marcus Weinman, a PhD candidate at the University of Vermont. And just a quick note, the views and opinions expressed in this podcast are those of the speakers. They don't necessarily reflect the American Public Health Association, the American Journal of Public Health, or the AJPH Student Think Tank. Hi, I'm Sam Mendez, a member of the AJPH 2024 Student Think Tank and a PhD candidate at the Harvard School of Public Health. Our co-host today is Jennifer Wells, who just got her MPH from the University of North Florida and also a 2024 Student Think Tank Fellow. In line with the theme of the May issue of the American Journal of Public Health, today we invited a couple of friends to pitch us a vision of the future of public health. And you'll get to vote on the winner, who we'll spotlight in our newsletter and on our LinkedIn. We also played some Two Truths and a Lie to get to know our guests a little better. The conversations spanned sexual health, health communication, vaccine development, coordination across the public health systems of all 50 states, and even Paddington too. So let's jump into it with our first guest, Kathleen Patti.
So I'm currently getting my master's in public health right now. I am very, very interested in sexual health, education, and wellness for people with chronic illness and disabilities. But I live in Florida. It's a beautiful state. Lots of interesting things happening here right now that are great. But yeah. So I've been here my whole life, and I'm excited to be a part of this group today. So thanks for having me.
We kicked things off with a game of Two Truths and a Lie. Kathleen told us 3 things about her, one of which is false. Can you guess which one?
So we'll start kind of easy peasy, you know. So first off, my biggest pet peeve in life is actually when you go to the bathroom and you realize the toilet paper has not been replaced. That's my biggest pet peeve, potentially. My second truth or lie is I really love to whitewater kayak. It's one of my favorite activities to do. And then my third truth or lie is that I recently saw the movie Paddington Bear 2, and I did not think it was worth the hype. I didn't get it. It was terrible. Even though it's like 100% on Rotten Tomatoes for the longest run of history, I thought it was overhyped.
Immediately, I feel like the Paddington is the lie, just because I can't imagine someone. It's like an inside joke with my friends about how, like, I remember this one quote from a review that was like, not only is Paddington 2 like the best movie of the year, it's the only good movie of the year. So that's my vote. I don't know what your read is, Jennifer.
It's like I want to say Paddington's the lie, but I know you already went that way, Sam. So now I have to go for toilet paper. But I just, I could see you getting really upset about toilet paper.
Yeah, it's
I'm gonna say the lie is Paddington.
The lie is Paddington. That's the best freaking movie I've watched in a long time.
Okay, so I guess I really will.
To be honest, saying it out loud felt wrong.
You did tell us you're bad at lying, and you did kind of falter while saying that one. So
I did. It was hard. It's hard to talk bad about that bear and that little red hat and his just. Yeah, if you haven't seen it yet. As a public health measure, I think every person needs to watch Paddington 2.
Okay. All right.
Good for your mental health.
Right.
Next up, a round of Two Truths and a Lie about Kathleen's experience with health and medicine.
first Mayo Clinic patient to receive proton beam therapy in the U.S., and was the first woman and one of the first children through Mayo Clinic. Another one is it has always been my passion to work in public health. And one of my third truths or lies is that I helped launch a young adult adolescent support group at a local children's hospital for children with serious chronic illnesses.
So, which of those three is the lie? Did you guess?
I think a lot like other young public health professionals kind of found themselves, found public health, and they found themselves in a situation where they suddenly got passionate, or they felt angry, or they saw a gap in health and they got involved. And that's kind of what happened with me. I had never heard of public health. I had been doing I'm a 2-time cancer survivor, spinal cancer survivor, and I had been through a lot of different health things, and I'd seen a lot of gaps in healthcare, a lot of issues with communication in healthcare. But it really wasn't until I started learning more about sexual health that I started really seeing some major gaps in chronic illnesses and sexual health identity. And then I just so happened to be trying to become a psychologist, I thought, but then I was talking to this professor and they were like, yo, you kind of boss people around too much and you're not really patient enough to be a therapist. And they asked me if I had heard of public health, and I was like, absolutely not. And so I talked to a public health professor at University of North Florida, and was a 45-minute conversation, and it made me realize I'd been doing public health work that was kind of related to it, but had no idea that's what I was actually doing. And it wasn't really until I went to the APHA conference that I really got to see what public health was, and knew I was in the right spot. So yeah.
That was just the end of last year.
That was.
Yeah.
Really, yeah, that I went with you, Jennifer. It was a great time.
I know.
It was an amazing time. It was so awesome.
And for Kathleen's vision of the future of public health, she pitched us an overall reimagining of sexual health care and education across not just schools, but stores, social media, and clinics. Let's listen in.
I just thought it would be so interesting if we could just, instead of going to a sex shop and talking to someone who really doesn't know what they're doing and really only there on their phone and whatever, I think it would just be really cool if we had a sexual health shop that was based less on, buying products versus educating people on how to use products. So, I think it would be cool if you got a 50% off discount if you watch these sexual health videos on consent, and here's how we use a vibrator, and here's actually how a woman's anatomy actually works. I think that would be a really cool business. If anyone listening wants to try to get in on that, I would be interested. but
Through our conversation, we learned how Kathleen's idea about the future of sexual health came from her own experience as a patient.
So, it's interesting because while going through cancer treatment, I think I have been talked about my health in pretty much every single aspect you could really think of. The way I ate, the way I breathed, mental health, physical health. But no one had ever asked me a question about my sexual health, unless we were talking about fertility. But once fertility was off the table for me, why would we ever bring up sexual health again? And then I also started learning too about how many physicians are afraid to bring up that conversation with their patients about sexual health, for many different reasons, like cultural reasons, or just because they think they themselves have never even had the sex talk. So why would they bring it up with someone else? So, and unfortunately, the reality of that is that I think there's a lot of people with chronic illnesses and disabilities struggling with identity. Specifically, I think we have a lot of people who get a chronic illness and now they're dealing with this new identity of being a person with an illness, but they've never even uncovered the identity of their sexual orientation. So they might try to seek some sort of normalcy without exploring themselves. I think there's like this very strong correlation with divorce and chronic illness, especially for women. So there's a lot of problems happening, and I don't think it's being talked about enough. And so that's where I actually think I got angry in that appointment because of it, and got so mad. And then Roe versus Wade got overturned the next day, and suddenly I was like, oh my gosh, what is happening in this world? What are we doing? And so I got mad and signed up for an MPH degree within the week. So that's kind of how this all started to kind of happen for me.
Stigma wise, do you have any thoughts on like how best to begin, or not begin, but continue the breaking down of the stigma?
There's an idea that we're going to ruin the children's minds if we talk about sexual health, but teaching sexual health is about protection at the end of the day, because you're teaching people how to also set boundaries with others and set boundaries with yourself, and know when they've been crossed, and how to get the right resources too to help you with that. And so I think teaching like this idea that sex is only for adults, it should be consensually at 18, but we can start learning about it at a much younger age. We can start talking to children about how to identify their bodies, which is so normal. It's on you. It's your body. we can start teaching teens about identity issues and feeling insecure, and what does that say about ourselves, and what does that say about how we are viewed in society. I recently did this sexual health training workshop with the OWL program with the Unitarian Church of, they're actually pretty, they have their own sexual health and wellness program. That's really interesting. And it was the first time they have a textbook, and they tell you what boobs are supposed to look like. And you open the book and it's like 300 different kinds of boobs, pairs of boobs in front of you. And you're like, oh, they're all beautiful. They're all interesting. They're all awesome. And, and here it's like, we look at, I don't know, just how sex is portrayed in the media, or how it is just so villainized in schools, and how we're taking it out. And honestly, yeah, let's take out the sex ed that we currently have in public schools and in private schools, and let's revamp it to something that is more inclusive, that is healthier, that is more about building confidence, building pride, building joy, building communication. Let's talk about that stuff, and let's start at an early age, and let's work our way up. Yeah, sex is about, let's protect our kids. Let's give them better sex ed. I also, I think another big thing is I keep talking about the kids, but I think also too, the adults need sexual health education. Significantly. It's actually funny, when I went through that sexual health educator at Florida State, it became so shocking to me how many adults don't really know sexual health either. And they might know how to do it. Like, we all came into the world somehow, but they don't know exactly like some healthy boundaries with it. They haven't explored their own sexuality in healthy ways with it sometimes, or they're kind of doing some old-fashioned stuff that's like, okay, like that's an old idea, or that's an old stigma, or that's a completely homophobic idea. So there needs to also be a revamp of these adults too. Everyone needs it. Everyone needs a refresh on their sexual health education. And I think it's becoming more and more clear now more than ever in the US of how much stigma, how much fear is out there when it involves sex or gender education. So,
okay, how do we start with that message?
I think we started with ourselves. I think we have to kind of start with ourselves and ask ourselves, how do we make ourselves feel safe, respected, and loved? And if we don't know, then that has to be explored. And that kind of goes back into those ties of how do we address our own stigmas? How do we address our own learning? What have we not learned? And I think through that, if, even like one person and their group is able to do that, they themselves might be able to become a sex educator. Because I don't think you have to have a degree to become a sex educator. I think you just need to have the education to become a sex educator and a love for yourself and a love for others. So that's my hope. I think we got to just start with ourselves first, and start with ourselves, and then maybe go to like a city council meeting or two. Start with your local community, start with your local groups, make sure people are okay. And you don't have to ask someone about their sex life. That's super personally, but you could ask someone how they make themselves feel safe, respected, and loved. And then, do they know how to communicate that? Do they know how to? Have you ever said no to someone? Ask those questions. Those can start out. There's no sexual themes with that, but it can lead to bigger conversations.
We have one more question. We'd like to ask you, what is something giving you hope right now?
I think one thing that has actually been giving me a lot of hope is actually being in class, being in an in-person class right now, and seeing other students want to do work in public health. That for me has given me a lot of hope that there are people that are wanting to create change for the good of humanity, for the good of all. And that's been really, really beautiful to see. I've experienced in my life with my treatment the beauties of having a chronic illness, and I will say that in a way that is very honest. I think, when you get diagnosed with something horrible like cancer, and it's scary and it's terrible, but you get to see how kind and how giving and how wonderful people are. You see people who have dedicated their lives to helping others through their toughest times. And with public health, being in this classroom where I'm surrounded by all these super intelligent, bright students has been really hopeful and really exciting for me. And knowing that no matter where our world turns, no matter where it goes, there will always be people trying to create change. And even going to the American Public Health Association conference, gosh, that was so cool to just see so many different people working in so many different avenues of health. Every room you walked into, it was like something totally different, and people in there that were passionate about speaking about it and hearing about it.
Thank you so much, Kathleen, for being here with us tonight. I had a lot of fun. I learned a lot about you, and I found new ways of thinking about sexual wellness and sexual health than I had really considered it before. So thank you, truly. Do you have, from the topics we've talked about, do you have any resources you'd like to share where people could learn more?
Absolutely. I think any person can benefit from going to amaze.org. I got a lot of really great comprehensive sex ed videos, specifically geared more towards like children and teens, but they're fun to watch, and it's a great way to just get some quick information. If you want to learn more too about, if you're a teacher, especially in Florida, there is a great website called the Florida Healthy Youth Alliance that gives a lot of great resources for teachers and students from different health educators about sexual health education. And I think that's also a really great resource to look up.
Thank you. And where can we find you online?
You can look me up on my LinkedIn. It's slowly growing, but be a part of the first phase of a very, very exciting growth of Kathleen Patti. Be at the first wave of that journey. And I look forward to connecting with you.
Thank you so much.
Absolutely. Thank you all. I had a blast. It's been great.
We covered a lot of ground there, and there's still more to come. We hope you enjoyed the conversation as much as we did. Stay tuned for part 2 of this podcast featuring a conversation with Marcus Weinman, and stay tuned throughout the year for a few more podcast episodes from us, where we'll have even more fun playing around with this new format. Don't forget to follow us on LinkedIn for more student highlights and to take part in our poll to decide who gets a special shout out in our newsletter. Thanks for listening.